Good evening, this is Candace Allen doing my Advanced Health Assessment Lab Practicum video. I'll be having the help of my RN friend who works over at Ocala Regional Medical Center in the ICU. Okay, so here I go. First I'm going to wash my hands using the hand sanitizer. Okay, and then I'm going to explain what I'm going to be doing today. So I'm going to be doing just a general assessment of your face, your neck, and neurological assessment. And then doing a little bit of teaching how to do a breast exam and checking for lymph nodes in the armpit or axilla. Okay. So first, I'm going to do assessment, a neurological assessment of a person, place, and time. So I'm going to have a seat just to make it a little bit more comfortable. So please say your name and date of birth.
Crystal Perry, October 6, 1985.
Okay, and what day is it today?
It is Friday, July 24, 2020.
Okay, and what city are you in?
Summerville, Florida.
Very good. Okay, so I would chart this or report this as being alert and oriented to person, place, and time, and also say that she has a normal speech, and I did not note any abnormalities with speech. She was not slurring or garbling her words, so I would consider that alert and oriented times 3. So next I'm going to just kind of do an assessment of some of the cranial nerves. So I'm going to have you smile at me, please. Very good. So there is symmetrical lifting of the cheekbones. And then can I have you scowl at me like you're angry? Very good. So there is also symmetrical movement of the forehead and eyebrows. Now clench your eyes tightly like you're scared. Very good. So again, symmetrical movement. And lastly, make a funny face at me and puff out your cheeks, please. Very good. So she is, I would report this as a most likely intact cranial nerve 7, which is the facial nerve. Okay. And so from here, I would do a test of the drawing a blank. I'm so sorry. Deep breath. Next is the sensation nerve. So I'll be moving on to the trigeminal nerve, cranial nerve 5. So I'll be checking the temporal mandibular joint. So I'm going to ask you to open your jaw and look. Open and close your jaw. Very good. So there is, I would report that as symmetrical movement of the temporal mandibular joint. But I do note some clicking on the right side of her temporal mandibular joint. And so I'm going to have you clench, I'm going to ask you to clench your teeth as well. Okay, so there is symmetrical raising of the temporal muscle. So next I'm going to go down to the masseter muscle and have you clench again. There is also symmetrical movement of the masseter muscle as well. So lastly, I'm going to have you close your eyes, and I'm going to push firmly or softly on different parts of your face, and you just tell me if it's firm, soft, and where I'm touching. Okay? So,
Firm forehead, soft chin, soft right cheek, firm left cheek.
very good. So I would consider that intact facial sensation of the skin on her face. So next I would be moving on to the next to the neck from there. So for the neck, what I'm going to have you do is just turn your head, look down, okay, and then look up, very good, and then tilt your head to the side, touching your ear to the shoulder, very good, and then to the other side, very good. So this is just basically checking for a general range of motion. So I would also have you press your head against my hand against resistance. So the muscles are very strong here on this side. I'm going to do same on the other side. Okay, very good. All right, so I would say that those are intact. The last thing I'm going to press on your shoulders. Resistance, very good. So that is the spinal accessory nerve. I would consider that one intact. Part of the neck assessment is also assessing for the lymph nodes that are found in the back of the head and just kind of around. So what I'm going to do is I'm going to palpate or feel the lymph nodes or where I would find them, and just let me know if you have any kind of pain or tenderness as I feel or palpate. Okay? So I'm going to start at the base of the skull, checking for the occipital lymph node, and then kind of move my way forward to behind the ear, which is the posterior auricular lymph node, and then move my way forward to the front of the ear to the the pre-auricular lymph node, and then move my way down to the angle of the jaw, to the tonsillar lymph node, and then just underneath the jawline to the submandibular or under the mandible, and then moving my way toward the center of the jaw to the submantle lymph node, and then moving forward to the anterior cervical lymph nodes, and then the supraclavicular lymph nodes, and then back to the posterior cervical. Any pain or tenderness felt?
No.
Okay, so next I'm going to just move behind you and do the thyroid lymph node and check for any kind of irregularity or inflammation, or what's known as a goiter. So no irregularity, both symmetrical, and no goiter noted. Next, I'm going to ask you to please stand up. I'm going to be doing, the next part is going to be the neurological assessment. I'm going to have you stand up and I'm going to do what's known as a Romberg. Have you ever heard of a Romberg? No. Okay, sometimes this is one of the tests that they do for like a sobriety field test. They have you stand with your eyes closed. So we're going to be doing that one next, okay? And then I'm going to have you walk into heel to toe, okay? All right. So I'm going to be maneuvering the camera as well, so I'll be off camera for a little bit. So what I'm going to have you do first is stand with your feet as close together as you can, and then close your eyes. Okay, and I'm going to note any kind of swaying or imbalance. Okay, so I don't note any abnormality with Romberg, so I would consider that a negative Romberg test. You can open your eyes. Thank you very much. So next, I'm going to invite you to walk about 4 to 5 steps in front of you in normal steps. Okay. I'm going to tilt the camera down. And then next, I'm going to have you do heel to toe and watch your balance. So I would say you were pretty well balanced. If there was any kind of irregularity with that, that would indicate poor balance possible in your ear, vertigo, or just kind of general weakness. Okay? So if you would like to, you can go ahead and sit back down. And then this is the other part of the neurological test. What I'm going to do is, is touch parts of your extremities with either or um, soft or pinchy or prickly objects. Okay, so I have a Q-tip, which is soft, and the end of a paper clip. So I'm going to have you close your eyes, and then just let me know if it's soft or hard, soft or pokey, and which extremity I'm pressing. Okay? Okay, so close your eyes. Thank you very much. Soft left arm. Sharp left arm.
sharp right leg, soft left leg, soft right arm.
Very good. So I didn't notice any abnormality with that, so that was also intact, I would say. So lastly, I'm going to test for, the word escapes me, stereognosis, which is recognition of an item when your eyes are closed. It's just a 3D recognition of an item. Okay, so I'm going to invite you to close your eyes again, and I'm going to place an item into your hand. Okay, and I'm going to have you tell me what it is. You can use the other hand if you need to maneuver it or try and figure out what it is.
Earbuds like headphones.
Perfect. That's correct. Yeah. These are my favorite ones whenever I need to ignore everybody at house. Okay. And then lastly, what I'm going to do for the neurological assessment is I'm going to have you place your palms up and have your eyes closed. And in one hand, I'm going to draw a shape. And in the other hand, I'm going to draw a number between 0 and 9. Okay? And this is testing for graphesthesia. Always trip over the words. Okay? So go ahead and close your eyes. I'm going to draw a shape.
Square.
And then next is the number. 0 to 9.
5.
Perfect. Exactly right. Very good. Okay, so I would also again say no abnormality with those tests. You do have seems to have all your sensations. So the last part of this is just a general education about the breast and axillary, which is the armpit exam. Checking for the lymph nodes, finding kind of landmarks and places where to check. So I'm not going to take a look at you, but usually you can do this at home about once a month when you're taking a shower and things like that. So I'm going to just kind of demonstrate what it is, and then, if you want to do a return demonstration, you're welcome to, but I'm just going to demonstrate what you would be looking for, okay? So normally what you would do is you would be undressed from the top up, looking in front of the mirror. And then you would raise your hands above your head, place them behind your head, kind of like you're relaxing in bed or, hammock at the beach or whatnot. And then you would be checking for dimpling or any kind of asymmetrical lifting of the breast, if there's any kind of muscle or what's known as fixation, that there's some sort of tissue that's pulling down on the breast. Okay, and then what you would do next, if there's, everything is normal, there are no dimpling, no deviations, anything like that, fixations, you place your hands on your hips and then kind of lean forward and again look for dimpling, deviations, unequal pulling away of the breast tissue as well. And just, going in for your, annual breast exam, usually starting, I want to say, around 45, if there is no history of breast cancer in the family. One of the risk factors for breast cancer is actually a family history of breast cancer. The other risk factors for possible breast cancer are being a Caucasian female over the age of 45, alcohol consumption, and um, hormone treatment of a combination of estrogen and progesterone after menopause. The likelihood of possible breast cancer does go up. How to recognize breast cancer upon examination is feeling a solid, hard, firm, dense mass in the breast area. Usually it tends to be in the upper right quadrant, close to what's known as the tail of Spence, which I'm going to go further into as well, of how to do a breast exam. And it's generally, it's not always painful, but it's usually pretty immovable. has irregular edges and is non-delineated, meaning that you can't really tell it apart really from the other breast tissue, but it's usually hard and firm and dense. Generally not painful. It doesn't mean that, if it's not painful, then it's not. Or if it is painful, then it's not cancer. It's always a good idea. Any kind of lump or anything, you should always get it checked out by the doctor. But one of the ways that you can do a self-breast exam to check for the lymph nodes is to find what's known as the tail of Spence, which is kind of a fatty deposit that goes into the axillary muscle and area. And so that's kind of this little area here. I can't really show you under the scrubs. And so you'd be checking for the lymph nodes that are in the breast and axillary section. So what you would do is kind of lift your arm a little bit away from yourself because you have one that's what's known as the central lymph node in the very center of the axilla, and just kind of like feel around in there. The one that's kind of in the pectoral area is the pectoral lymph node. And then kind of right in front of the scapula, but in the back area here, right here, is the suprascapular, or excuse me, subscapular lymph node. And then kind of along the edge of the humerus is the lateral or brachial lymph node. So if you feel any kind of pain, swelling, lump in those areas, it's always a good idea to get those checked. Okay? All right. Did you have any questions for me? All right. Well, thank you so much for participating. Have a wonderful day, and I'll see you tomorrow.